Hey, it's Jeff. So I just want to talk for a minute about the automated external defibrillator, the AED. We use this on the patient who is without a pulse. Often we do 2 minutes of CPR first to circulate oxygenated blood before applying the AED. The first step for using the automated external defibrillator is to turn it on. Once we turn it on, what it will do is tell us next to apply the electrodes to the patient's bare chest. So when it says bare chest, it means bare chest. So if I take off somebody's shirt and they have a real hairy chest, I need to take a little surgical razor that's in the kit and shave that hair off. I may not have a razor. And then what I'm going to do is, hopefully I have a spare set of pads or some tape. I'll apply that to the chest and then rip the hair off. I know it sounds painful, but if you rip the hair off and the person screams, they're alive. You really don't need the AED. So keep that in mind. So in this situation, we clear the hair off the chest. If the person has any moisture on their chest, maybe we pulled them out of the water, maybe they were sweating because they were having a heart attack, diaphoretic they call it. If the person's sweaty or wet, dry off their chest with a towel. Some people who have a history of heart disease may have a patch on their chest which says NG or nitro. That's nitroglycerin. That helps dilate the blood vessels so blood can flow better. But with an electric charge and the nitro, it is slightly explosive. You're not going to blow the person up, but you could cause a flare up on the chest, and we don't want to, remove hair that way. So let's just try to get that nitro patch off the patient. We want to make sure we have gloves on or use something, to protect our hands to pull that patch off. Nitroglycerin, if it comes in contact with our skin and we have a normally low blood pressure, it could lower our blood pressure enough that we get a headache and possibly pass out right next to the patient. You're no good to the patient if you're unconscious next to him, so make sure you protect yourself before you come in contact with the patient's nitroglycerin patch. Once the chest is clear, then we can apply the pads. We always look at the pictures on the pads, so these are adult pads, and it tells us to put one on the right clavicle area and one on the left lower ribs. It's always important to remember that the heart is between the two pads. So, in most cases, in a lot of cases, the person's heart's on the left side. My 30 years, I think I've met 2 people that have their heart on the right side, and then you would have to switch the pad placement. But for the most part, the pictures on the pads are usually right. The person's heart's on the left side, right clavicle, left lower ribs. If for some reason the pads are too close together, we always move this pad more towards the back. So if it's a pediatric patient, we're using the smaller pediatric pads, and it is possible that if you don't have pediatric pads, you can use adult pads on a pediatric patient. We would just put one pad on the front and one pad on their back, just like we would as the picture shows us in the pediatric pads. So the first step for using the automated external defibrillator is to turn it on. And just listen to it.
Apply pad to patient's bare chest. Plug in pads connector next to flashing light. Apply pads. Plug in connector.
Plug in the pads.
Analyzing heart rhythm.
Everybody stand clear.
Do not touch the patient.
No contact.
Shock advised.
So it's a shockable rhythm. We'll talk about that a little more in depth in a second.
Stay clear of patient. Deliver shock now. Press the orange button now.
Everybody stand clear. We want to have no hands-on contact when we hit the shock button because somebody could possibly get shocked and end up
Deliver
like
shock
this guy.
now. Press
Everybody
the
stand
orange
clear.
button
Shock
now.
on 3. 1, 2, 3.
Shock delivered.
It's safe to touch the patient now. No
Begin
signs of life.
CPR.
Start CPR. So now you can just do compression-only CPR for 2 minutes without breathing if you don't have proper airway devices. Otherwise, you're doing 30 compressions to 2 ventilations, and you'll keep doing the 30 compressions, 2 ventilations till the defib tells us to stop when it starts to reanalyze. So just backtracking a little bit, does the defib jumpstart the heart? No, it doesn't. You may have thought that in the past when you've seen it on TV. They used to take the paddles and put the paddles on the chest. Boom, the body jumps. It's like a jump start. But realistically, what's happening is that in our heart, we have a main trigger called the SA node that fires and causes the whole love-dove process, right? That whole love-dove process where it's actually like pumping normally. But in this situation where the defib has told us to shock, the heart's just shaking like a bowl of jello. The main trigger to use the defib is that there's no pulse, but actually this electrical activity is still in the heart. It's still doing something, but not enough to circulate the blood like a normal heart rhythm. So we have to convert that abnormal rhythm. What the defibrillator does is it stops the heart temporarily. Hopefully that main SA node takes control back and it goes back into a normal rhythm. So when we send that electrical current through the heart, it startles the heart, stops it temporarily, and then hopefully the heart starts beating again. Not always does it work, but there are a good amount of times that it does work and convert that abnormal heart rhythm. No matter what, every time we shock, we always go back and check the pulse. If there is a pulse, great. Just monitor the patient, maybe put them on this side in the recovery position. That way if they happen to vomit. But if there's no pulse and the defib is actually saying no shock indicated, the heart may have stopped completely. In those situations, this isn't going to start that stopped heart. So we just have to go back to doing CPR. So there are those times that the defib says no shock indicated. And if it says no shock indicated and the person is without a pulse, go back to CPR for another 2 minutes, either 30 to 2, 5 times in a row, or just 2 minutes of compression only CPR. And in 2 minutes, this may reanalyze. It's still on, the pads are connected, it will reanalyze in 2 minutes, but it's probably still going to say no shock, unless for some reason, the heart has started back up. But in most cases, when it says no shock indicated and there's no pulse, the outcome is not always that great. So that's how the defib works. That's the true story about the defib. It doesn't jump start the heart. It actually temporarily stops the heart to convert that abnormal rhythm. Thank you. This is Jeff. It's important that you take a full CPR and first aid course. You can contact me anytime at jeffforcpr@gmail.com or call me or text me at 978-335-5300. Thank you.